Transference is defined as the displacement of feelings from one person to another. Countertransference is when the healthcare provider projects their own thoughts and feelings or emotion onto the patient. Prejudice is described as a negative impression or feeling acquired without knowledge, thought, or reason prior to the event. Bias are defined as preconceived preferences or inclinations, especially one that inhibits impartial judgment. So I once had a patient who was very critical of me and everything I did. She would make comments about my appearance, my bedside manner, and the way I communicated with her. She would also tell me I was doing my job. I was not doing my job properly and that I should be doing things differently. I soon realized that she was projecting her own thoughts, feelings, and emotions onto me. I was able to recognize that she was doing this because she was feeling vulnerable and afraid, and I was able to provide her with the care she needed by remaining calm and non-judgmental. I also made sure to communicate with her in a clear and concise manner. So yes, I've encountered this before. I think it originates from a place of vulnerability and fear. When a patient is feeling vulnerable and afraid, they may project their own thoughts, feelings, and emotions onto the healthcare provider in order to feel more in control. Yes, it is acceptable for me to continue to care for the patient by being calm and non-judgmental. I will avoid these difficulties from impacting the treatment I am able to provide to a patient. In addition, I will ensure that I communicate with the patient in a clear and concise manner. Another patient interaction in which there was transference, countertransference, prejudice, and bias or judgment was when the patient said that he was not comfortable with me because I am a woman. He said he would prefer to see a male provider. I told him I would be happy to refer him to a male provider if that's what he preferred. I explained that I am a qualified provider and that I am comfortable providing care to him. I told him that I would be happy to answer any questions he had about my qualifications. I offered to provide him with a list of male providers in the area if he would like. I told him I understood his preference and that it would be that I would do my best to accommodate his needs. This is something I have not encountered before. I think that the patient's preference for a male provider is a result of his own personal biases and judgments. I do not think that this preference is a result of my qualifications or abilities. I think that the patient's preference is a result of his own personal experiences and beliefs. I think that it would be appropriate for me to continue to provide care for the patient. I would do my best to accommodate his needs and preferences. I would also do my best to ensure that his care is not affected by my own personal biases or judgments.